It is open enrollment season for both workers and retirees.
I'm stressed. With
Me
plans
too.
changing, CBS News business analyst Jill Schlesinger joining us from New York to help guide us through this process. Please help us, Jill.
Oh my gosh. I mean, 154 million people feel your pain. That's how many people actually get health insurance through their jobs.
Yeah, but listen, I'm one of those people, I clicked those buttons when they first hired me here. I've never looked again. I don't know what I have.
Well, and I'm the one that told her we're going up 7% this year, which is
Right.
pretty standard for, it looks like, the rest of the country. So how do you weave through this? Are there ways to save? What should we be doing here?
Okay, so instead of just checking the box that you do what you did last year, create a list of your doctors and your prescription. Just make sure they're still covered. Maybe the plan is fine. Maybe it's okay to do what you did last year. But, you know, these plans change all the time. Maybe your company has added a new provider. Maybe your company's offering a high deductible health plan, which I think are really interesting plans. They offer lower premiums in exchange for higher deductibles. They're paired with health savings accounts that help you pay for those deductibles and out-of-pocket costs. The health savings account is incredible. It's triple tax advantage, meaning the money that goes in is not taxed, and the money that's in the account grows without taxation. And when you pull the money out, there's no tax. So if you can do that, not just for your health care costs now, but for decades in the future, this is a big advantage for you.
That's a good point. I know it's also open enrollment for Medicare. So what should people over 65 be looking at this year?
Well, I think that they're in the similar position as workers in that they have to spend some time with their plans. Unfortunately, with Medicare, these plans change dramatically from year to year. So from now until December 7th, you're going to enroll, change, or drop a Medicare Advantage, that's your Part C, or the prescription drug plan, Part D, and this all takes effect January 1st. But again, insurers, they can just pull out of Medicare. They can change the scope of benefits, their cost sharing, services, drugs that are covered. So it's really important to focus on the process because I think otherwise we're kind of throwing some money down the drain.
Okay, and then open enrollment for the Affordable Care Act opens on November 1st. So what's expected for costs there next year?
Well, this is a real question mark because remember, the whole government shutdown is predicated on the actual change in the enhanced premium tax credits for the Affordable Care Act. So you probably don't remember this. When we first had the Affordable Care Act, we had tax credits that were awarded to people who needed some help paying for their insurance, so lower income people. Under the Biden administration, those tax credits got bigger. They enhanced the premium tax credit, but those enhancements are actually going to expire by the end of this year. And that means that for a lot of the 24 million people who are insured by the Affordable Care Act, it's going to cost more to pay for their insurance. So some may get a smaller tax credit. Others might lose their eligibility altogether. That means it's going to cost a lot more for the Affordable Care Act for a lot of people on the plan. Some may choose to go down a plan, maybe go from a gold plan to a silver to a bronze. Others may say, I'm just going to pay more for this. And still others, I hope not too many, are just going to say, I'm not going to go with insurance. That's so scary to me. It's such a risk, even if you're young and healthy.
Well, I just had a friend who unfortunately lost her job, and she was saying, you know, I have finances, I'll be okay, but I don't have enough to cover my medical costs if something goes wrong. So that is a real concern for people out there. So I hope people are listening, Jill. Thank you. You can see Jill regularly on CBS Mornings and the CBS Evening News. For more analysis, go to JillOnMoney.com.